This is Krista Finch, Family Nurse Practitioner and Director of Nursing at the Union County Health Department. I'm coming to you today with a community health presentation on the topic of smoking cessation. We're starting today with a brief survey to see what you might already know about smoking cessation. You'll have an opportunity to take the survey again after the presentation, so please go to this link and scan the QR code and take a couple of minutes to answer these questions to the best of your ability. If you think about smoking cessation, what comes to mind? What does cessation mean? And as a quick response, cessation generally means to stop or end something. So smoking cessation means the act of stopping smoking. After today's lessons, we'll meet these learning objectives. First, you'll be able to discuss the impacts of smoking and vaping on adults. You'll be able to identify how smoking impacts children during and after pregnancy, identify different types of tobacco smoke exposure, and identify at least one resource to help you stop smoking. Before we go any further, smoking does not make you a bad person, but quitting smoking or vaping before pregnancy is good for you and it's good for your family's health. Today we're going to talk about smoking cessation. We use the general term smoking. That means different things to different people. For example, that might mean smoking cigarettes, vaping, or using e-cigarettes. And for some, it might be a thought or a feeling. This is in part due to nicotine, which causes your body to release a chemical in your brain. We'll be using these terms throughout our talk today and going into more detail. Nicotine is a very addictive chemical. It forms naturally in tobacco plants. Nicotine is also added to vapes. That chemical change causes changes in your mood and makes you feel good, for a short time anyway. Because nicotine works fast, but only for a short time, it can be really hard to stop. But it's very important to stop because it can cause serious health problems, which we'll discuss more later. And before we go too much further, we want to talk about the types of tobacco smoke exposure. First-hand smoke happens when someone smokes a cigarette or vapes and smoke is inhaled by the person who's using the tobacco product. Secondhand smoke is released from smoking cigarettes or exhaled when someone is smoking or vaping. Then it's inhaled by another person, much like the kids in the middle picture. Third-hand smoke occurs when smoke residue builds up over time. This can happen on items like walls, carpet, curtains, etc., and it can get back into the air when someone touches it. Kids are at risk for third-hand smoke exposure because they may crawl on surfaces or put non-food items in their mouth. We'll start by talking about what smoking does to your body. The smoke from cigarettes or vapes have over 4,000 chemicals in them. When you smoke or vape, your body is impacted in so many ways. Smoking damages your lungs, your brain, and causes cancer in many other parts of your body. Smoking can also make it really hard to have a baby, and smoking can cause you to get heart disease or have a heart attack. Let's learn a little bit more about these areas. You might know that smoking causes lung cancer, but did you know that smoking also increases your chance of getting other types of cancer, from your nose to your mouth, in your throat, stomach, kidneys, and more? You even have a higher chance of getting cancer in your ovaries, where your body holds eggs for pregnancy, and more. Smoking can also hurt your heart. The nicotine in cigarettes make your heart beat faster and raises your blood pressure. This could lead to a heart attack. Smoking can also make it hard to get pregnant. For women and birthing people, this involves two different areas, hormones and eggs. Smoking causes changes to your hormones, which are an important part of getting pregnant. Smoking also damages your ovaries and eggs, which can grow into babies. Also, if you smoke while getting pregnant, there's a higher chance of having a dangerous pregnancy where the egg grows in the wrong place. This is called an ectopic pregnancy. Smoking doesn't just hurt someone's ability to get pregnant. Smoking also impacts men by damaging the sperm. And if a damaged sperm fertilizes an egg, that can result in a miscarriage where you have a pregnancy loss. While we just talked about how smoking can make it harder to get pregnant, you can definitely get pregnant while you're smoking. And smoking while you're pregnant can cause many more problems. First things get passed along to your baby by the umbilical cord. This includes good things like nutrients in the foods that you eat, but it also includes bad things like nicotine and chemicals from smoking. This is how smoking can damage your unborn baby. So let's talk about what kind of damage can happen. All types of smoking can have problems for your children and for you, and the children that you have now and the children that you might have in the future. And we talked about how chemicals from the smoke can get to the baby by the umbilical cord. If that happens, your baby could be born too small or too early. When this happens, babies often need to stay in the hospital after they're born, and it's not good to have a small baby. Smoke can damage your baby's brain and lungs as they're growing in your body. Your baby could also be born with a birth defect, like a cleft lip, and need surgery. Smoking also contributes to SIDS, or sudden infant death syndrome. Sudden infant death syndrome is caused by an otherwise healthy baby that dies for an unknown reason before they turn 1 year old. They usually don't know why the baby died, but it often happens when sleeping. The risk of SIDS is higher if you smoke, vape, or use other substances while pregnant. It also happens more often to babies that are exposed to secondhand smoke. For others at home, like other children, being around smoke can cause problems with their lungs and their eyes. Kids exposed to smoke also get sick more often with ear infections, cough, and pneumonia. This can be worse if your child has asthma or already has trouble breathing. This relates to secondhand and third-hand smoke we mentioned. Even if you don't smoke in the same room as your child, smoke builds up in your home, on the walls, the carpet, the curtains, and can cause problems even months later. And as we just heard, the risk of SIDS is higher. While some people consider vaping as a safer alternative to smoking, that simply is just not true. Vaping can cause some of the same problems as smoking. The pods that are used with vapes hold liquid that has nicotine, other addictive elements, and harmful items like chemicals, heavy metals, and other toxins. Some e-cigarettes actually contain more nicotine than your regular cigarettes. Vaping can damage your body in similar ways as smoking, like damaging your lungs, causing a cough, increasing your heart rate, and much more. The second and third hand smoke concerns are also similar. The second hand smoke that comes from vaping contains the same chemicals that are breathed in by the person that's vaping. The third hand smoke can still linger on surfaces like carpet. And finally, vapes can be very dangerous for children because of the pod or cartridge that contains the vape liquid. Children can get nicotine poisoning and end up in the hospital. If you want to have a baby, it's important to stop all substances. Using drugs or alcohol when trying to get pregnant can cause many health problems. There is no safe level of drinking alcohol when pregnant. Drinking alcohol while pregnant can cause many different issues. Babies can have birth defects and disabilities. They can have developmental problems later, like trouble thinking or doing well in school. Marijuana in any form can be bad for the baby's health. The chemicals in marijuana, like THC, go through your body like nicotine does and can cause your baby to be too small. The secondhand smoke from marijuana has some of the same toxins and chemicals as cigarette smoke, which we know now are bad. Babies can have growth issues and be born too small. They can also have developmental issues where it makes it harder for kids to learn or behave well when they're older. Opioids and other illegal substances also need to be avoided. If not, babies can be born with drug withdrawal symptoms, where they may need medicine or stay in the hospital after they're born. These babies may cry more and they may have trouble eating or sleeping. However, there is treatment available. There are many risks if these other substances are used during pregnancy, in addition to what we've already talked about. Pregnancy loss might happen, and this is known as a miscarriage. The baby might even die during pregnancy. If the baby is born, they might have lifelong mental or physical problems. They also have a higher chance of dying from SIDS before they turn 1. Also, babies exposed to substance use during pregnancy often need to stay in the hospital to get better before they can go home. Mental health issues like overdose is the #1 cause of pregnancy-related deaths in Ohio. If someone you know is having an addiction crisis, here are some resources to help. You can call or text 988. This is a free and available 24 hours a day program to help with the overuse of alcohol and other drugs, and also mental health needs. Do not use 988 if someone is overdosing. You still want to call 911. The Ohio Consumer and Family Toll-Free Bridge is supported by the Ohio Mental Health and Addiction Services. It provides referral and resource information for callers regarding addiction, mental health services, supports, and organizations statewide. The phone number and email address are listed here. The National Rehab Hotline is free and available 24/7, 365 to help anyone struggling to get through a substance use or mental health crisis. It helps them get immediate help. So now that's discussed smoking cessation. Remember, that's the act of quitting smoking. We've talked about how smoking can impact you, your family, and your future children. Now let's talk about what to do next. You may be wondering what benefits might happen if you quit smoking, and there are many. Some benefits happen quickly, while others will take time. I put a few on this slide, but I'll say many more. There are many health benefits alone. Lower heart rate, better sense of smell and taste, lower risk of developing some of the cancers that we discussed. You'll cough less, you'll have less lung damage, just to name a few, and your family will also benefit, both by lowering their risk of health problems that come from secondhand smoke and with less of tobacco smoke on you. There are also financial benefits. Cigarettes are expensive. You'll save money by not smoking. If you want to quit, the first step is to get some support. And this can look different for everybody. Try talking to your healthcare provider or someone you trust. You can set goals, like not smoking in your house or your car, or set a goal to limit the amount that you smoke in a day. But a great option is the free Ohio Tobacco Quit Line. The Quit Line is free. It's very flexible. You can call 800-784-8669 to talk to somebody trained to help you quit. You can also get free quit medications like tobacco gum or patches, or you can scan this QR code to sign up or find the click to chat option to learn more. Getting signed up just takes less than 5 minutes. It's quick and it's easy. Do you know of any resources in the community that could help people quit smoking? Maybe you or someone you know tried to quit, but they're still smoking. First, be kind to them and yourself. But maybe it's time to try again. It can take the average person 7 to 10 times to be successful quit smoking. Maybe this time you have more time or energy to focus on it. Maybe this time you'll get free medication from the Ohio Tobacco Quit Line to help, and just maybe all the pieces will come together to quit for good. But it's worth trying for you, your health, and your family. As a recap, today we talked about how smoking and vaping causes problems with your lungs, your heart, and can cause cancer, and it can lead to a heart attack. We also talked about how smoking and vaping can cause problems during pregnancy, or your baby could be too small, be born too early, or have birth defects. We talked about firsthand smoke from actively smoking, secondhand smoke that comes from cigarettes, or someone that breathes out, and third-hand smoke that builds up on surfaces where people smoke. And finally, we talked about ways to stop smoking, including the Ohio Tobacco Quit Line, which offers support and free medicine to help you quit. Before we wrap up, please take a couple minutes to help us understand what you learned and where we might be able to share more information in the future. This is your chance to retake that quick survey from earlier. Do you have any questions? If so, feel free to call our office at 937-645-2058. That's the Union County Health Department at 937-645-2058. Thank you so much for attending. This presentation was supported by the Health Resources and Services Administration's, or HRSA, Maternal and Child Health Block Grant, and the Office of Population Affairs, OASH, Title 10 Services Grant of the U.S. Department of Health and Human Services, HHS, as part of a financial assistance award. The contents are those of the author and do not necessarily represent the official views nor an endorsement by HRSA, OASH, or HHS, or the federal government.